The technique of indirect ophthalmoscopy has the advantage of giving you a much wider field of view, so you can see much more of the fundus at one glance. However, it loses some magnification because of that, and also the image is going to appear inverted with left and right transposed. If you look at the image of me in the condensing lens, you can see I'm upside down and left and right are the wrong way around. That's how the fundus is going to appear when you do this technique. Inverted and left and right, back to front. So your requirements to perform indirect ophthalmoscopy are a patient with a dilated pupil, a dark room, a condensing lens, and a focal light source. The patient should be directly looking at you. You want to imagine that there's two steel wires coming from the middle of your pupils to the middle of your patient's pupils, so you're absolutely eyeballing them. You then want to make sure that your light source is parallel to your gaze. So you hold it at your temple or at your nose. Ideally you'd have it there between your eyes, but that looks ridiculous and gets in the way. So at your temple or at your nose, so you're looking directly down the beam of light. If you have your light coming in from an angle like this, it is going to be reflected on the lens to disappear over your shoulder. So you want to line it up with your position of gaze at your temple, at your nose. So we've got our patient looking at us. I'm relying on my assistant to hold the lids open for me and hold the dog's head straight. And then I bring the light source to my temple and I move until I see the tapetal reflex. And he's looking down towards the floor now, so I would have to go in that direction to line up with his pupil and see his tapetal reflex. I then bring the hand lens close to his eye. That will focus the light on the back of his eye and becomes really quite bright for him, but at the moment I can see a really nice view of his fundus. And just by adjusting how far away the lens is from the eyelids, I can get the fundic image to fill the lens. If the lens is too close to the dog like that, I see lids and iris in the image. If I gently pull the lens back towards me without changing anything else, I will see just the fundic detail in the hand lens.